coincides with the 70th anniversary of the Health Service. Dr. Tony O'Sullivan is the co-chair of Keep Our NHS Public. He's on the line right now. Good evening, Tony.
Good evening, Justin.
Welcome to the show. We thought that a lot of people would turn up to this demonstration today. So how many people actually turned up? Do you know?
Well, we estimate about 50,000.
Wow. 50,000 people today in London.
Yes,
that's incredible.
it was the whole breadth of Regent Street, for example, as it walked down right across the road. And it took about an hour for the whole process from the beginning of the march arriving to the end of the march arriving.
Are you surprised at how many people actually did turn up today? Because I don't think you in your wildest dreams would have thought that 50,000 people would turn up for this.
Well, we were very pleased because it was a really hot day, but we've been campaigning very strongly with other organisations under an umbrella called Health Campaigns Together and with People's Assembly. And we had a march over 200,000 in the middle of the winter crisis last year. And again, this February, a smaller march this February. So we were very, very pleased, but we weren't surprised. We were just very grateful. And it was campaigners from up and down the country, really, wanting to give testimony to an alternative narrative to the government, who are saying that the NHS is safe in their hands. And we know from tireless work up and down the country that if it weren't for campaigners countering the government's undermining of the NHS, the underfunding and the fragmentation of it through enforced competitive tendering and privatisation, if it weren't for campaigners slowing things down, overturning decisions to close hospitals, countering, challenging contracts, taking the government to judicial review, if it weren't for all that, we would have actually seen even worse damage to the NHS. So, and I do feel that Theresa May was responding to the strength of the campaigners' message and the health community, the health staff and health managers and think tanks to say, well, I'd better give them a little bit of money, otherwise they won't go away.
Because we've heard this week there could be further cutbacks to the NHS, and every time we talk about the NHS, it seems to be cutbacks. So today, you and 50,000 people on the streets just to purely say, look, we love the NHS, leave it the way it is, don't take away, build on it. Is that essentially the message that you had today?
Well, leave the original ethos the way it is, which was a public service giving, and this isn't just about ideology, it actually demonstrably gave the best service in the world for the most cost-effective cost. And the cost of the market has actually escalated the budget for the NHS without the payback for staff. And when you've had an eight-year austerity imposed on the NHS, you get the situation where there's 100,000 vacancies, 4 million people on the waiting list, A&E targets for 4 hours abandoned by NHS England officially because they know they couldn't meet it, and worse cancer rates, worse cancer responses, and so on. So it's in crisis, but the original principles of a publicly funded NHS that was available to all people at their time of need without fear of bills, that is still the envy of the world. And people in America are saying, please, for heaven's sake, do not give up on the NHS. If we could have that in America, we'd die for it. Well, sorry, that's the wrong expression. But we'd give anything. Yeah. We'd give anything for it. So that is what we were saying. And we're saying that if you stop privatisation, you could actually save, and I'm not saying this is research-based, you could save billions of pounds, at least £5 billion.
Who said that? Who's come up with that research?
Well, King's Fund, Nuffield Trust, those think tanks have said that the cost of the market, which is, if you have a situation where clinical commissioning groups are forced to put out to tender clinical services, otherwise they will be going against the regulations under the Health and Social Care Act and the European competition law, and that's the situation we're in.
Right.
If you're forced to go out to tender, then you have to have tendering teams, contract monitoring teams, defensive marketing, lawyers to challenge situations where you're not being given the tender, and of course that the private companies like Virgin have all the money at their disposal for legal challenges.
Tony, we've got a lot to squeeze in on tonight's show. Just lastly, 50,000 people in London today with this protest. Just lastly, do you think it will make any difference whatsoever moving forward?
Well, I think it has made a big difference already. I'm an ex-children's consultant. I worked in children's disability, but my heart is in saving the NHS, and to do that, we've got to win people's minds. And politically, we've got lined up now a big change in the Labour Party, for example. Not so successful at all in the Conservative Party, but there are a lot of MPs who are worried about their future if their local services, even in Conservative constituencies, are closing down. The Labour Party is now committing to drawing up legislation to renationalise the NHS, put the NHS back firmly as a duty to provide for the Secretary of State, and to restore the public ethos and the respect for professional doctors, nurses, therapists, radiographers, and so on, and to cut out the waste that truly is enormous, from private finance initiative and the Carillion disaster, and so on and so forth.
Tony,
I know
you've certainly had your say tonight. I've got to leave it there, but I do appreciate you coming on. Thank you very much indeed.
Thank you very much. Thank you.
There you go. That was Dr. Tony O'Sullivan there, the co-chair of Keep Our NHS Public. 50,000 people today in London at that protest. That is a lot of people, especially on a day like today as well, where it's absolutely baking hot. Let's go to Alan, who's in Milton Keynes, talking about all sorts of things. Alan, good evening.
Good evening, Justin. How are we?
Yes, very well indeed, sir. Welcome to the programme. What have you got for us?